Hey guys, Dr. Patricia Delgado, nurse practitioner with Sunrise Skin and Wellness. Today I'm going to tell you guys about the difference between semaglutide or Ozempic and tirzepatide or Mounjaro. So semaglutide is known by the brand names Ozempic and Wegovy. Tirzepatide is what we know as Mounjaro and Zepbound. Semaglutide was developed first. It was FDA approved for type 2 diabetes as Ozempic, and then it was FDA approved for weight loss as Wegovy. Tirzepatide was developed for type 2 diabetes, known as Mounjaro, and then it's known as Zepbound for weight loss. So what's the difference? Semaglutide came first. It is a GLP-1 agonist. GLP-1 is a hormone that's secreted by our small intestine that tells your brain, hey, you're satisfied, you're not hungry anymore, you're good to go, you can stop eating. The tirzepatide is also a GLP-1 agonist, but it is also a GIP agonist. So it actually mimics two appetite suppressant hormones. So semaglutide, one hormone, the tirzepatide, two hormones. So of course, in the studies that the manufacturers did to get cleared for FDA approval, the tirzepatide actually did show more weight loss when compared to semaglutide. So something to keep in mind, but you might be thinking, well, wouldn't you get more side effects when you're on tirzepatide? Not necessarily. Anecdotally, we have been seeing that there's less side effects to the tirzepatide versus semaglutide. However, it is also a newer drug, which means it is a little more expensive. But always make sure you call your insurance first, see if your insurance will cover it, because if you do meet the criteria, then have your insurance help you to lose the weight or to help you with your type 2 diabetes. Another thing to keep in mind with tirzepatide, they have put out a statement that if you are on oral contraceptive pills for my females of childbearing potential, make sure that you are using an extra form of contraception, such as condoms or spermicide, because one of the effects of these drugs is that it slows gastric emptying. So it's going to slow down your absorption of your hormones when you take your pill. So something very important for you to know. Other things to keep in mind when you're on semaglutide and tirzepatide is that these are not just magic drugs that are going to help you to lose those 10 pounds, lose those 15 pounds. It's just a shot once a week, easy peasy. No, you have to be doing your strength training 3 times a week, 150 minutes of moderate to intense exercise. And by exercise, it can be walking vigorously, like power walking, or any type of exercise, but you have to increase your physical activity. Nutrition, you want to be eating every 3 to 4 hours. Make sure that you are getting sufficient caloric intake. Generally speaking, you want to calculate your basal metabolic rate and also take into consideration your physical activity. There are calculators online. Subtract 500 calories and go from there. Work with a nutritional coach or with your healthcare provider that can talk you through and help you be more mindful with your eating. Something else to keep in mind, you want to increase your fluid intake, increase your protein intake, because the protein will help you to feel fuller longer, and it's also going to help with your nutrition. Some people think that, oh, these weight loss medications, these anti-obesity drugs, they cause hair loss, but they don't. Malnourishing yourself will cause hair loss. Or they might get headaches or feel tired. If you're dehydrated by not drinking enough water and taking in enough electrolytes, then you will feel tired and feel other effects. So these drugs are not quick fixes, you guys. Make sure that when you, or if you are pursuing being on one of these medications, first, call your insurance, see if it's covered. And second, make sure that you see somebody who really cares and wants the best success for you and who's going to talk you through it and make sure that it is the best option for you. So give us a call if you want more information. Patricia Delgado, Sunrise Skin and Wellness.